Health officials in Washington state are now urging people to carry naloxone due to a sharp rise in overdose deaths. Fox 12's Bridget Chavez is showing us step by step how to administer the life-saving medication and where you can find it.
Overdose deaths in Washington state are rising at an alarming rate, and now the Washington State Department of Health wants everyone to carry naloxone to help prevent deaths from opioid overdose. Naloxone is a medicine that rapidly reverses an opioid overdose.
It's absolutely necessary. I think that there should be complete community saturation of naloxone. Every person should have naloxone on them.
Emily Skogrand is a clinical pharmacist at OHSU and says an overdose can present itself in multiple ways.
If someone is unresponsive, you'll want to administer a sternal rub and see if they respond. Overdose could also look like that they're struggling to breathe or making a gurgling sound when they're breathing. It could also be that their fingers or their lips are turning gray or blue.
You can get naloxone at many local pharmacies. It comes in two different forms, a nasal spray or a muscular injection, similar to getting a shot. Skogrand says both forms are equally effective, but the nasal spray is easier to use. The nasal spray comes in a container like this.
Take out the vial. You want to press your two fingers on top by the nozzle. You'll then want to insert the nozzle into the person's nare all the way up until your fingers touch the bottom of their nose. And then you'll want to press down on the plunger, administering the naloxone spray.
The other form naloxone comes in is this intramuscular injection kit.
You'll next want to take your vial of naloxone. You'll flip the lid off, open up your syringe, remove the cap, press the needle into the plunger, turn the vial upside down, draw the entire liquid into the syringe, pull the vial off. You'll then want to pick your site. So pick a muscle with a big muscle with a good blood supply, so your arm or your thighs.
Skogrand says the kits come with 2 doses, and in some cases you may need to administer an additional dose, but you can never give someone too much.
No, there's no danger in administering too much naloxone. You can't overdose on naloxone. All it would do is reverse the opiate effect, so the patient may not feel very good.
Skogrand says it's important to make sure everyone in your home knows where it is and how to use it if needed. And she suggests making carrying naloxone as common as carrying your phone or keys.
You never know when you're going to be in a situation when you would need naloxone. And also, what a powerful tool. It's a life-saving medication. You are able to save someone's life with just a spray in their nare.
Bridget Chavez, Fox 12 Oregon.
And we do have resources for where to find naloxone, both in Washington and in Oregon. You can just go to our website, that's kptv.com, and click on this story.